Good evening, everyone. Hope you can see and hear us clearly. If not, you can drop us in the chat box. Welcome to session 1 of NEET UG counseling guidance, which is going to be very, very important for your choice filling process. Moving forward, speakers of today. We are having here Dr. Sheikh Mohammed Wasim, MBBS from SV Medical College, Tirupati, then DNB General Surgery from Apollo Mysore Hospital, then FICM for Intensive Care from Apollo, and he is a life member of ASI, Association Surgeons of India, IMA, Indian Medical Association, and IATCC, Indian Association of Trauma and Critical Care, AMASI, Association of Minimal Access Surgeons of India, ACRSI, Association of Colorectal Surgeons of India, and also Association of DNB Doctors. He has published more than 10 national and international publications and attended multiple national conferences. We welcome you, sir. Followed by that, we are having here Dr. Pallavi Madam, who did his MBBS from Hassan Institute of Medical Sciences and completed his DNB Pediatrics from Apollo BGS Hospital, and he is a resident in Apollo. After that, now he is a consultant in a corporate hospital, and he is a life member of Indian Medical Association and Indian Academy of Pediatrics. We welcome you, ma'am. Next one is Dr. Syed Samila Hussaini, completed his MBBS from Manipal Institute, Karnataka. Then currently he is a DNB General Medicine resident, and he is also a member of Association of Doctors of India. Followed by we have Dr. Naveen S, who did his MBBS from BIMS Ballari, Karnataka, and MS General Surgery from MMC Mysore, and is a university third rank holder in MS exam. Followed by that DNB General Surgery. Finally, super special DNB Surgical Oncology, HCA Bangalore. He is a life member of Association Surgeons of India, Association of Minimal Access Surgeons of India, Indian Association of Gastrointestinal Surgeons, Indian Association of Surgical Oncology, and Indian Medical Association. He has published multiple national and international journals. Followed by that, we have Dr. Rishwan R, MBBS from Government Stanley Medical College, Tamil Nadu, DNB from Apollo BGS Hospital, Pediatrics, and he has published international journal as well. Followed by that, we have Mr. Kumar Madhav, who is a counseling expert for more than 12 years in the NEET UG, PG, as well as the allied medical branches. Successfully have placed more than 10,000 students in their desired branch through his right guidance. And myself, Dr. Sridhar, who completed my MBBS from Government Stanley Medical College, Chennai. Currently, I am a medical officer in charge of Labor Welfare Organization Karnataka under Central Health Services. Followed by that, I worked as an ex-contractor in. So once again, I congratulate everyone who have completed the NEET UG examination in a colorful manner. And if you are seeing this video, definitely it is that you are in a safer zone to get one or other rank in a dream place. So we will move forward with the agenda of today's sessions. So the agenda for today's session is jam-packed in such a way it should be covering almost every topic as much as possible. Now you would have been in the preparatory phase. Moving forward, you are in a real-life scenario, moving from school to your college life. How it will be, the career-making decision is just few days ahead of you. So keeping those things in mind, the agenda is prepared, which includes the introduction, then the statistics till now, then the eligibility, college choices, nature of MBBS, post-MBBS scope, the transition from school to college, the need for counseling guidance. Now I would like to call upon Dr. Wasim sir, a consultant surgeon from Bangalore, to discuss in general about the NEET UG counseling process as well as the examination.
Good evening, everyone. Thank you, Dr. Shiva. Good evening, everyone. First of all, congratulations for clearing your NEET UG examination. Now that you have cleared the NEET UG examination, you have got a good rank, you are qualified in the examination. Now you are going to enter into an important phase in your life where you will be transitioning from being called as a college student to being called as a doctor. So now you are going to become a professional from now onwards. So this is a stage where you are going to get responsibilities of being a professional in a profession which is in the medical field, for which right now, because we are discussing about NEET UG and MBBS career scopes, so we will be focusing mainly on that. Coming to NEET UG, see this examination, National Entrance Eligibility Test for undergraduate. We have a postgraduate exam also that is called as NEET PG examination. So previously there was All India Pre-Medical Test AIPMT, which was conducted separately, and also every state used to have a separate examination for entry into MBBS, BDS, or other courses. So previously, because there were multiple exams in multiple states, and people who are in a who want to give their exam or who want to join MBBS, there was a need for them to travel to multiple places, appear for multiple examinations, register, and everything was there. So to avoid all these issues, to bring everything under a single umbrella, to streamline everything, so central government has made something called as NEET undergraduate examination. So single examination, you will write only a single examination, you register for that. This examination is conducted by NTA, National Testing Agency. So single examination, single day, you write the examination, you get a rank, and based upon that rank, you are eligible to apply for MBBS courses all over India. So in this session, further we will be discussing about what is the scope of this NEET UG counseling. With the NEET UG rank, what and all the courses you are eligible, what and all the places you can apply for the counseling, and what was the recent statistics regarding that, and all those things we'll be discussing further. Because now we are focusing mainly on the MBBS part. First of all, MBBS is Bachelor of Medicine and Bachelor of Surgery. So it is a undergraduate course which is designed in a pattern such a way that you will become a bachelor of both medicine and bachelor of surgery. So that, as the name prescribes, the medical specialties as well as surgical specialties, you will become a bachelor. You will be getting a bachelor degree in this field. The course duration is 4.5 years plus 1 year of internship. We'll be discussing that in the further fields. So I hope at this point regarding the introduction of NEET UG and what are the scopes, we'll be slowly discussing in the further. Yeah, over to you, Dr. Sridhar.
Thank you, sir. Actually, that was a very nice introduction per se. To add a little bit of that, the thing is, over the past many years, we could have seen the different trends happening in the MBBS entrance. Before 20, 30 years, when the super seniors were there, they were entered into MBBS medical colleges via interviews, even via sponsorships. Followed by that, we have certainly had All India examinations. Followed by that, the name has been changed to NEET. Now everything is streamlined and it has brought into under the umbrella of NEET UG, and for postgraduate NEET PG and super specialty. So everything is streamlined. Keeping that in mind, whatever it is, the MBBS remain the same. Entire the curation, what all the subjects over the last 30 years, nothing has changed much. Same routine subjects are there. Only the entry of that is changed a bit. So moving forward, we will discuss each and everything aspect of MBBS curriculum as well as the statistics of the current examination. So moving to the statistics, we could generally see here when compared to the NEET UG 2021 to NEET 2022, total number of qualified male is around 4,29,160 members. Female are 5,63,902. So it is like total qualified members itself is almost like 99,000. 9,093 lakh, 9,93,069. Sorry for that. So moving forward to the category-wise candidate registered, appeared and qualified during NEET 2021 and 22. Here I would like to call upon the counseling expert, Mr. Kumar Madhavji, to explain about the trend which has been happened over the years related to the registration and the qualification aspect.
Yeah, hi everyone, Kumar Madhav this side. So let's see like category wise, like number of candidate registered Like, see, actually, if you see the data, so based on that data, like OBC candidate and general candidate, they are in huge number. So if we'll see 2021 data, then OBC registered candidate and appear candidate were almost like same only. So if you see the total qualified candidate in 2021, it was 3,96,000. And if you see in 2022, OBC total qualified candidate is 4,47,000. So, and for general category, if you see 2021 total qualified candidate, it was 2,39,000, and this year general qualified candidate 2,82,000. So we can see some like increment in OBC qualified candidate and some decrement in general qualified candidate. First, because of EWS 10% general candidate, they have been shifted towards EWS. So because of that, we can see some like decrement in qualified candidate in comparison to last year. So there are like few candidate like they comes under general category, but they applied through this EWS quota. So if you see the total number of like NEET UG qualified 2021, then it was 8 lakhs 70,000, and in 2022 it's 9 lakhs 93,000. It's almost more than like 1 lakh candidate they got qualified this year. So there will be one huge competition. Plus, obviously, seat number has been increased, but there will be, we can see like some good competition this year, and we are expecting that competition to be high.
Yeah, thank you, Madhavji. In short, if you want to say, there is definitely a race. The people who are registered for the examination, appeared for the examination, as well as who are qualified for the examination. There is a clear-cut race in the competition as well. So in just like 18 lakh, among 18 lakh people, around 10 lakh are qualified. Those are seats which are having in our hand, including both the government and the private seat, is around 95,000 or 1 lakh. And every state is now here and there that in the seat increase in their state colleges. Still, the competition is 1:10 ratio out of the qualified numbers. So moving forward with a little bit of statistics, we are having here the categories number of candidates qualified is based on qualifying criteria for NEET UG 2031 and 2022. We don't want to bore much here related to the marks, change everything, because you are already tied up with all the examinations. You aced the examination and you are in the right place in the next phase of the career. So coming up with a state-wise candidate registered appeared qualified during examination 2022, I would like to call upon Dr. Wasim sir, because he himself completed UG in a different state, Andhra, and he is completed his PG in a different state, Karnataka, practicing as a faculty in a private medical college. Background is from a government medical college of MBBS. So he would have seen all the arenas, how the MBBS students are right there. Now he is even conducting the examination for MBBS students. So I would your note on that, sir, as well as the state-wise list.
See, if you go by this slide here, a state-wise number of candidates registered, appeared, and qualified during 2021 and 2022. Yeah, see here in this slide, you can see the state name, number of registrations, and number of students appeared, and number of students qualified. You see here the major chunk of the students who have applied for the examination in this slide. You see from Bihar, 95,150 students have registered for the examination, and followed by, you can see, Gujarat, 79,228, Andhra Pradesh, 62,051. And there are few more other states which are not there in the list. They are in the list, in the further list as well. See the here you can see the Karnataka 1,18,978, and Maharashtra 2,27,659. So why we are why this data is important is because the Karnataka, Kerala, Maharashtra, these are the states where there are a number of medical colleges. There is a huge number of medical colleges present there. There are government colleges as well, and there are private medical colleges as well. So these are the areas you can see where the students are in more number and they are competing for the medical seats, for MBBS seats. And here's Tamil Nadu as well, 1,21,000, Uttar Pradesh 1,74,000. So generally, if you see there, these are the states where there are medical colleges in more number, where the what you say, there is a huge high competition going on there. So regarding this candidature and the students appearing here, there are government colleges in every state, as well as there are private medical colleges in every state, as well as there are deemed universities also. Now, previously, if you see, government medical colleges were very less, to be frank, because now that this year there have been a discussion that the government has made a plan that it should increase the medical infrastructure, it should increase the MBBS seats. What the government has made is, along with the existing infrastructure which is already is present with them, they want to attach medical colleges to those hospitals. So that is what is happening actually, to be frank. So that is the reason why, if you can see district hospitals in the respective states, there what is happening is government is trying to attach a medical college to the district hospital. For example, if there are 20 districts in a state, the government of India and the state government in collaboration, they are trying to they are trying to build a medical college and attach that medical college to the already existing district hospital there, so that a new medical college will come up. So they are making sure that every district will be having a government medical college, and there is no further capping as of now on private medical college. There can be medical college as well in the same district, but as of now the capping is different from region to region. But what I have observed personally is, if there is an existing district hospital without a medical college attached to it, government is trying in such a way that it should attach a medical college to the concerned district hospital which is already present. So in such a way, the seats are also increasing in the number. So and then here, in the further slides we'll be discussing like what is the scope of the NEET UG. Like NEET UG counseling will be in different parts. See, there is first of all, see the medical MCC, the committee is conducting counseling. So it's a MCC is a body which conducts the counseling for MBBS seats, BDS, and all the other categories of seats which are under the medical stream. This conducts the counseling at the central level. You should also know that there are multiple state authorities like KEA, Karnataka Education Authority, and Andhra Pradesh Medical Education Board, Andhra Pradesh Higher Education Board, Gujarat Board, Pre-Medical Board of Maharashtra. So all these committees, they conduct the counseling in the respective states. But MCC conducts the seats counseling at central level, in which, if there are, for example, if there are 1 lakh seats all over India, out of that 15,000 seats which are in the central pool, for those seats, MCC is going to conduct counseling. So 15% of all India quota seats of MBBS or BDS seats of states. So there you can see that in the slide for which this centralized body is going to conduct the counseling for. And also 100% MBBS seats of Benares Hindu University, open category, AIMS, All India Institute of Medical Science open seats. You should know that here, because here we are talking about AIMS. All India Institute of Medical Sciences, initially it was only in New Delhi. Okay, it was a single body which was present in New Delhi. And later, Government of India had made reforms and made sure that they start to like increase number of AIMS institutes all over the country. So later, All India Institute of Medical Science started to open up different branches all over the India. You have AIMS Bhubaneswar, you have AIMS Rishikesh, okay, you have AIMS Amaravati in Andhra Pradesh. So there are multiple AIMS, the All India Institute of Medical Sciences, which have opened all over the India. So those institutions also have MBBS seats in them, and MCC is the body which is going to conduct counseling for them, and based on your NEET UG rank as well. And JIPMER is present in Pondicherry and Aligarh Muslim University. So basically, it is you can here see AFMC, Armed Forces Medical College. Only the registration part is done by them, and later they will hand over the data to the Armed Forces Medical College, and they will conduct their counseling separately. So basically, from this slide, you should know is the 15% of the quota of the seats given the central level. Further, the counseling is being conducted separately by NCC, but the rest of the 85% of the seats all over the India, for them, the respective state bodies are going to conduct the counseling separately. For that, you have to apply in the respective state board. Whenever the notification comes in that respective state, you have to go to their website and then apply for the counseling in that state. Yeah, I think it's over to you. Yeah, over to you.
Thank you, Dr. Vasim sir. It was very exhaustive and very informative as well. The thing is, single exam, the exam is already done, marks have come, the rank has come, and it is there at your hand. But the options are enormous. When you consider the All India of 15%, you could see in the screen, you could enter into any of those things, which is carried out by MCC. Apart from that, from the 85% of the thing, all the state com will have their own criteria. So it is not that restricted. When the days were very early, we did not have any access to the internet. Much of the data is not available to us. We will be restricting ourselves to our own district or even to the nearby district or max to max till our territory of our domicile state. But whereas in this hyper-connected world and in the digital connectivity, digital India, we get to know about everything, all the colleges possible because of the social media platform and other sites as well. So to streamline everything and give you the right content here, this session has been designed. Moving forward, related to the MCC related counseling process, the reservation policy is also very important, because when you have seen the total number of people who are eligible, always in a higher edge over the others. In that, if the reservation is also there, there will be little edge towards them. They can try that in the All India as well as in the state counseling. I would like to call on Mr. Kumar Madhavji to discuss little about the benefits of the reservation policy here, because when we are dealing with UG here, there are many seats in the hand, almost 1 lakh seat. Number of people qualified is 10 lakhs. So how edge make it difference? Because the people are in the very crucial stage, whether to be like a repeaters now, or we need to try for a counseling now. Because there are 2 to 3 times repeaters, might think twice before entering into the next year of counseling, next year of preparation as well. So this will be a guiding yardstick for them. How to view this scenario?
See, obviously this reservation, it matters a lot. So if you'll see that this thing last year closing rank and all, then because of this reservation, like there are like candidates whoever are having reservation, and they are getting very good benefit in high rank also. For example, like if you'll see last year SC category rank, I'm just comparing SC with general. First of all, we'll see the percentage of reservation. Then we'll talk about the comparison. So if you see SC category, they do have 15% reservation, and ST category 7.5%. PWD, like PWD means physically handicapped. So physically handicapped in every one physical handicap candidate is there. He or she may be from any category. So they are giving 5% reservation for all category, all physically handicapped category candidates. Either if they are having like EWS or is there ST category, general, whatever it is, they'll get whatever seats are reserved. Out of that, 5% seat will be reserved for physically handicapped candidate. And if you see OBC, then in OBC there are 2 types of OBCs. One is OBC non-creamy layer, so, and second is OBC creamy layer. So non-creamy layer, whoever are having like family income below 8 lakhs per annum, so for them they can take the benefit. And the certificate should be made in the central list format. Like one format is there. So based on that format, central format only, that OBC certificate should be made. So, and for EWS, 10% reservation is there, and one court case is still going on regarding that 10% reservation, and 13th is the date of hearing of the EWS. So these are the reservations. So how this reservation like affect? So if you'll see one student like is from like, if you'll see last year data, then if one student is from like general category, then the last closing rank for general category was 21,000 plus. And if you'll see other candidate and from belongs to like SC category, then they got seat in 1,30,000 plus rank. So this is the difference. Like the difference means like based on their rank and based on their NEET score, like they do have like benefit if they comes under SC or ST category or is physically handicapped.
Okay. Thank you, Madhavji. That was insightful. Little bit of quick question regarding the timelines of unfolding of this counseling process. It will be better. Can you explain about the timelines, tentative timelines?
See, actually, still like MCC, they have like few days back only the result has been out. So minimum they'll take like 20 days. I guess from next month onwards they'll start this counseling process. And it's still like seat increment process is still on. So even I saw like seat increment in few colleges. So like if you see like last year data, then last year around 80,000, 82,000 plus seats were there. But this year, like we can see more than 10,000 seat increment. So seat increment is huge. Now we can talk about the state-wise total colleges and total seat increment till 10 September. So if you see Andaman and Nicobar, then there is no change in seat increment, same seat. As per last year, only one college is there. And Andhra Pradesh, like we can see some seat increment and like if you see Arunachal Pradesh also no seat increment, Assam also no seat increment, but in few colleges we can see the seat increment. And if you see the total number of seats, then total number of seats means states like Karnataka, states like Tamil Nadu, Maharashtra, they do have huge number of seats. As Dr. Wasim said, he discussed before, like regarding this number of seats and all. So there will be some like positive and negative impact. We can't discuss over here, like what will the impact without getting proper data. So like 1 lakh extra candidate, 10,000 means again whatever Dr. Sridhar told, 1:10 ratio. So they are increasing seat like 1:10 ratio. Means 1 lakh candidate is more than like they have increased that 1:10 ratio seats.
Exactly. So if you see that high volume states are Karnataka, where there are around 63 colleges having around 10,000 seats. Maharashtra concerns 62 colleges is having 9,895 seats. Followed by that higher thing is one more Tamil Nadu, which is having around 70 colleges, both private and government mixed, around 10,725 seats. So in total, we are having 92,793 seats, whereas the total eligibility is 9 lakhs. Reiterating the fact that 1:10 ratio. But there are so many other factors and components here when we're discussing about the seat uptake. One is the reservation, followed by that other important self components are involved when choosing a state. When the people are in the South India choosing a college in North India without a data would be a very cumbersome process, and anonymity will be there, uncertainty will be there. Similarly, the scenario for North Indian people who are the domicile state in North, when coming to the South without having the proper data in their hand, coming to a college for the next 5 to 6 years of planning will be a difficult task. So, moving quickly forward related to the top government colleges based on the All India quota. Dr. Pallavi, madam. Yeah, over to you, madam.
Yeah.
The top government medical college based on All India quota, it has been projected in this way.
Yeah. Thank you, Dr. Sridhar. Congratulations, everyone, on clearing your NEET. And all you will be expecting what are the top medical colleges, especially you all will be very keen about it. So we have made a list. So Maulana Azad Medical College, it is the top medical college according to the last year closing rank, followed by the Vardhaman and Atal Bihar Vajpayee, and Chandigarh College, and in Karnataka it is the St. John's, and in Chennai it is the Madras Medical College. But there are other factors which you should consider while choosing your college that we'll be discussing in the further slides. Sridhar. Yeah.
So this slide is having the top 20 private medical college. That is CMC Vellore, KMC Manipal, Amrita Vishwa Vidya Peetham from Kochi, St. John's, Ramachandra JSS Mysore, DY Patel, KMC Mangalore, KLE University, Belgavi, Then from Bhubaneswar, Amishadan, SRM Institute, Chennai, MS Ramaya, Bangalore. So this is just a gist of how things are happening. So moving to the centralized institute, we are having AIMS Delhi one is the first, with the closing the All India rank of 53 last year. This time also like but 50, it will be ending up. Followed by that is Jipmar Pondicherry, then AIMS Rishikesh, Raipur, then comes Bhopal, Jodhpur, Patna, then comes Bhubaneswar, Nagpur, Vijayawada, Bhatindia, Deoghar, Rabareilly, Gorakhpur, Kalyani, Bibinagar, Rajkot, Guwahati, Bilaspur, Madurai, and Jipmar, Puducherry, and Vijayapur, J&K. So these are related to the centralized institutes. So coming in general, now we'll just talk, no need to go specific about the ranking of those aspects, because just now you have got the ranking. Now we want to do your own research of what all the things possible at my end for my rank. There are only two options: whether you are going to sit for another year for preparation, repeat the examination, give the NEET next year, or give a shot of counseling this year. If at all you are eligible, because 10 lakh people are eligible. Even that might not be relevant. Suppose, for example, just for a number's sake, 8 lakh or 9 lakh of eligibility in a ranking, can still try an option how the counseling process is going on. Because then, even though you're repeating the exam for next year, it will be easy for you when the process goes on. You know the process, how we are going to go forward the next year. Anyway, you are going to pass through the same entrance and same entry aspect as well. So little bit of knowledge of the professionality and the professional course related, you need to know what general is there. Becoming a doctor is a bigger umbrella. So where exactly you're going to do and how exactly you're going to do, what are the factors it is going to affect you, that we'll discuss. If you already discussed these factors or kept everything in your mind, well and good. If not, analyze critically with all these components in your mind about their feasibility, your rank, your preparation strategy, your academics, and everything. Moving the main components of choosing whatever the college is. There are three components. They are government related, either it is central institutes or state medical colleges, or it is a private medical college, or it is a deemed one. Dr. Wasim sir, your personal opinion, because you have come to a number of colleagues in your entire career related in all the diverse field. Your opinion on this, sir, when it comes for undergraduation especially.
That's actually a good question, Dr. Sridhar. I would like to first tell, you have the data with you. The last rank, what was the last closing rank? For which college, what was the last closing rank? And when you compare the last year's data to the present year's data, the point is there is still the process of addition of the seats is still going on. Like Mr. Kumar Madhavji had told already that the number of seats are going to increase this year. So the hope is still on. If your rank doesn't fall in the category of the last rank of the last year, you need not get disappointed, because the seats are going to get added. So there is always a scope. So usually when we observe how the pattern of the trend goes on, students first select government medical colleges. Then if they don't get the government medical college, they go for a private medical college. If they don't get a private medical college, then they go for a deemed university. So this is in between. It's not a thing like a flow. Like if you don't get this, you go there, you go there. There are multiple factors in selecting a college as well, in selecting a medical college as well. For example, there are top rankers where there are multiple deemed universities. There are very good deemed universities available in your state as well. For example, if you take Karnataka, you have Manipal University with you. It's a very good, it's one of the top university offering MBBS courses in India. So if your rank is good, even for getting into those colleges, your rank should be good. So people who don't get Manipal, they go and select other private medical colleges. It's nothing like there is something a fixed matter that government, then private, then deemed, nothing like that. So there are multiple factors where you usually go and see. And the second point, because the seats are going to increase, because I have been a faculty in medical college as well, and I have studied from a government medical college as well. The point here is, every college, be it a government medical college or a private medical college, it applies for inspection. Previously, it was Medical Council of India. Now it is under National Medical Council, NMC. So every college applies for National Medical Council inspection, and the team comes to the medical college, sees all the available resources in the medical college, and all the checklist is being done. Whatever the thing which are important for to run a medical college, how is the infrastructure, what is the intake, how is the patient load, how are the academics, the faculty, everything is taken into picture, and then later based on the proposal given by the college. For example, if the college is already having 100 MBBS seats, if they are asking for increase of seats for 100 to 150, those things and all will be decided by the counseling committee. If they want to start a new medical college for new session, then there as well, based on their application, based on the criteria, they will allot the seats as well. So here the number of seats which are going to increase this year are either already the medical college is there and the seats are going to increase in the additional to the already approved seats, or there are new medical colleges coming up where the new addition of MBBS seats are going to happen. So here you can see the subcomponents to consider while shortlisting a college. As I've already told you, there are multiple factors here. I'll just go in an order. First, you see popularity. So that's what I was telling you. So based on the how a popularity of a college comes into picture is based on the track record. So how was the the infrastructure, how the patient load is present, how are the academics, and how the teaching is going on in the concerned medical college, and based on the other factors like since how many years the college has been started, since its inception. For example, there are very old medical colleges which are 50, 60, 70, 80-year-old medical colleges. You can see Madras Medical College, Stanley Medical College, they are almost a century old. They are more than 100 years old. So based on that thing also, one of the component is get shortly because the name, few medical colleges, the name itself speaks for them. You did not even go and check what is going on in the medical college. The top medical colleges, the name itself speaks for them. And the second point is city. Based on the city where the medical college is present. Few medical colleges are there in a metropolitan city. Few medical colleges are there in peripheral parts, district, taluk level. Some are even in the rural background as well. But they are a bit isolated from the town or city, but they are in a separate campuses for own themselves. And the third point is bond. This is very important. People will be thinking, what is this bond and why it's concerned in MBBS? No, it's important. Because when you are joining an MBBS course, it is very important whether you are signing a bond to the concerned medical college or not. Bond is something where you are giving in a written statement on a legal document that you are going to serve the concerned authority which is giving you an MBBS seat into entry into that college, that you will serve to that authority for a period of either 1 year or 2 years, whatever is prescribed by the concerned government. Okay, so it means after you finish your MBBS, after you finish your internship, you have to go back to the concerned government, report to them, and they will make a merit list. And out of that merit list, you will be given posting in the concerned medical college or taluk hospitals or wherever the health centers, wherever the vacancy is available. So that is what is called as bond. Along with that, if you don't want to do bond, if you want to break the bond, there is a specific amount of money which you have to pay them. That ranges from 50 lakhs to 20 to 50 lakhs to 1 crore as well in a respective universities. You have to be very sure. So it is very important in whatever medical college you are going to take admission, you have to look at the bond as well. And the fourth point, patient load. Yes, it is very important. If you have always, I advise the students, because students keep on asking me, sir, I am getting some medical college which is far away from my home, and I also have an option to take a medical college which is near to home. I would personally tell them, see, prefer all these factors when you are going to select a medical college, when you have an option. So it is very important because you have to stay there for a period of 4.5 years. So it's very important that the place where you are going to stay for 4.5 years also matters. So you just compare the medical colleges where the options are available. So this is where the correct level of guidance comes into picture. So you are in a state where there are 3-4 medical colleges around you. You know them, fine. But what about the medical colleges all over the India, in the other states? You don't know anything about them. So you should get proper guidance. If you are getting an option of some medical college which the even name you don't know, but you want to know how is that medical college, because you want to compare to something which you know. So the data is very important, that you should know what is the thing going on in that medical college as well. So that is where the correct guidance is important, and it's very important where you do your MBBS as well, because for a whole life you are going to be the alumnus of that concerned MBBS medical college. So it's also a very important
That's
point.
true, sir. Yeah.
And then later, yeah, that's true actually, that everyone will accept the fact.
Even
And the
everyone will
next is
accept the fact
internship.
that.
Yeah.
So coming
Absolutely.
to the internship part, I would like to
And the
call
next-
Dr.
Yeah,
Pallavi,
yeah,
madam.
Yes, Sridhar.
Yeah.
As Dr. Wasim said, these are all the points which are very important. Internship, it will be of 1 year, and it will be after the 4.5 years course of your academics. So including the internship, your MBBS will be of total of 5.5 years. In case if bond is there in that state, it will be after your internship. It is not included in the internship, whatever the bond is there. So in case if 1 year bond is there in a state, so your whole MBBS course will be like 6.5 years. If 2 years bond is there in that state, then it will be like 7.5 years. This is the thing. So internship, it is basically, it is like you'll be working in all the departments, all the subjects where you have studied. So you'll be getting to know about each and every subject, and you'll be seeing the patients. That is the thing. And in the internship, uh, 2 months of compulsory community medicine internship you have to do in the college where you have studied. That is the compulsion. After that, you can take a transfer. That is one point you should keep in mind. Coming to the other points, the state. See, I would like to tell, in case if you are from a state where you are having only 2 or 3 medical colleges, yeah, in case if your rank is good, but see, always choose a college. If that college is good which is in your state, definitely you can go for it. Otherwise, next option will be your keep a state which is having more medical colleges. That should be your option. Just because some state is next to your state that is having again the few medical colleges, that should not be your option, or that should not be your priority, because MBBS, it is like a STEM. Whatever you do, the PG courses or whatever the post MBBS options are there, it is like the branches. So your STEM and whatever the route is there, it should be like very strong. So it is better, it is always better if you do a MBBS from a state where there are more medical colleges, because that will open the door for you for the PG entrance also. That is one thing. And coming to the language, 5.5 years course of MBBS, definitely you should learn the language where you'll be studying. And it is not very difficult in case if you are willing, and you cannot complete your MBBS in case if you don't want to learn that language. That is one thing. And family circle, yes, that is also important. And financial support, see, as you can take central seats of government in the government college, you can take through all India, and you can take through a state this thing, and also you can take in private medical colleges, and also you can take in deemed colleges. These are the options you have got. So always definitely go for government colleges. That should be your top priority, because the fees, everything will be less. And also your patient load and all will be good. And coming to the private medical colleges, always choose a college which is old. As Dr. Wasim said, some colleges by the name itself speaks, and you'll be the alumni of that college for your lifelong. So it is like the definitely MBBS like an umbrella. It is like choosing the color of the umbrella. That is like choosing the college. And post MBBS, there are so many options, and it is post MBBS career, it is like very vast, that we'll be discussing further. Yes, Sridhar.
Yeah. You don't have to bombard them with all much of information. Just now they come from biology, physics, chemistry. So little bit we want to transit them from the physics, chemistry to the 19 subjects head to toe of all
Yeah.
concerned to medicine. So slowly we'll take them. So importantly, the parameter here is the data wise is the bond one. So each states have their own set of guidelines set for bond. Now I'd like to call Mr. Kumar Madhavji. He's a counseling expert for more than 12 years. He exactly knows how the people have got into the bond, into a trouble, or how they would have came back, or what was the penalty they were paid or levied to them. What was the compulsion to them before going to the post-graduation of their medical curriculum? Yeah.
Yeah, hi. See, actually, like bond is very important. Like before joining any government college, we have to know like proper details about bond. See, like even I used to get lots of calls from the students, parents. They used to say, "Sir, if I'll join a college this year, and next year if I'm getting good rank, then can I leave that seat?" So yeah, they can leave that seat, but there will be some bond breaking penalty. So at the time of like there are like basically if you see in college then there are like different bonds. Like at the time of joining medical college they have to sign different bond. First, like the service bond. If that particular college they are having service bond, then candidate or his parents they need to sign that bond. Second is seat leaving penalty bond. If the candidate they are leaving the seat or is because of some like activity colleges they are kicking them out, then in this condition also they have to pay penalty. Third, anti-ragging bond. So these are the basic bond they have to sign at the time of joining. So let's start with this like bond duration and bond penalty and which all colleges they are having the bond. So we'll start with Andaman and Nicobar. Andaman and Nicobar they are having 1 year bond and bond penalties of 10 lakhs. Means like after completion of MBBS, you have to serve for 1 more year. If you don't want to serve for 1 more year, then you have to pay 10 lakhs penalty. And one more important thing is here, like there are few states they used to allow candidate for PG. So without serving bond, you can go for PG, and after completion of PG, you have to come and whatever bond duration is there, you have to serve for that. So in Assam, they do have 5 years bond and bond penalty amount is 30 lakhs. And apart from this, Chhattisgarh, they do have like 2 years bond duration and bond penalty amount is of 25 lakhs. And Goa, they do have 5 years bond. So it's a and bond penalty amount is 5 lakhs. And Haryana, like it's very much confusion. Like Haryana, they won't like ask you to serve for bond, but they'll charge you some like extra amount. Extra amount is the kind of bank guarantee or something like that. So for 7 years, you have to pay that bank guarantee and all, and the amount of that bank guarantee is of more than 36 lakhs. So before joining some college, like especially like BPS Medical College Sonipat, they are charging this amount. And apart from this, ESIC they do have 1 year bond and one like penalty amount is of like 5 lakhs. And Karnataka, they do have 1 year bond and bond penalty amount is of 10 lakhs. And if you see Kerala, they don't have bond, but the seat leaving penalty is of 10 lakhs. Madhya Pradesh, they do have 1 year bond and a bond breaking amount is of 10 lakhs. And seat leaving penalty is higher than bond breaking amount, it's 30 lakhs. So, it depends upon the state. In few states, like bond breaking amount is different and seat leaving penalty is different. So before joining any medical college, we should know this thing. Maharashtra, even they are having 1 year bond and bond breaking amount is of 10 lakhs. And if you'll see colleges like JLN Medical College Manipur, even they don't have bond, but bond break like seat leaving like penalties of 10 lakhs. And apart from this, in Pondicherry also they don't have bond, but seat leaving penalty is of 4 lakhs. And like if you see Rajasthan, then Rajasthan they do have 2 years bond and seat leaving penalty and bond breaking amount both are same. It's of 5 lakhs. Tamil Nadu they do have 2 years bond and bond breaking amount is of 10 lakhs. And Agartala, GMC Agartala they do have 5 years bond and bond breaking amount is of 25 lakhs. So before joining Government Medical College Agartala, candidates should note this thing. Bond breaking amount is of 25 lakhs and bond service duration is of 5 lakhs. But GMC Agartala, they'll let you go if you want to go for your PG studies. So apart from this, if you see Uttar Pradesh, they are also having 2 years bond and 10 lakhs is the bond breaking amount. West Bengal, they don't have any bond, but like discontinuation of course, you have to pay 1 lakh as a penalty. And apart from this, like few like ESIC and few deemed university, even they are asking for bond. So like we do have all those data, so anyone can WhatsApp me if they want that data.
Definitely. Thank you, Maharajji. Because since the bond is a very important factor A little bit of discussion over there would have helped all our viewers. In between, meanwhile, if any user is having difficulty, anything, hearing or viewing that live session, please drop in the chat box, as well as whatever the queries is there, the chat box is open, and we'll try to address as much as questions as possible. So, coming to the sub-components to consider while shortlisting, we have seen about the popularity of the college, the city where it's going to be, then the bond details, the patient load, the internship, then the state, the domicile or the different state, the language, financial support, family circle, as well as post-MBBS. I would like to call once again Dr. Wasim sir to add any other points to fill up this if it has been missed here.
Yeah,
Even apart from this, yeah.
The factor of the state and why the bond thing was discussed and why the state thing is being stressed is, as Dr. Pallavi ma'am has also told, go to a state where there are a lot of medical colleges, and because once you go and study MBBS in that state where there are a number of medical colleges, you will become domicile of that state medical college. That will indirectly impact your further career as you want to apply for a graduate seat. Because in the state where you already are a local member, you become a local member because you already that area. It is also very important in other area aspect. Just one example to you, like for example, they they will be thinking, yeah, that I have become and that I have examination. They will have goals in life. Like I want to become audiologist. I want to be
Yeah, Wasim sir, can you refresh a little bit? Your voice is, audio is little breaking up. Yeah.
Dr. Sham, my audio.
I think if you could kindly refresh it, it will be better. So meanwhile, when Sarah is doing, yeah, we'll go on to the, we will just open a door or window of what is going to be in MBBS in a gist, because now you have completed your NEET exam. Next is for the next 5 years, this is your timetable. It should be stick everywhere, wherever in the hostel is concerned. So you start with the foundation course on August, followed by the first MBBS starts. Then we will subsequently have the exam on phase 1. So many things. When we were there, it was August, February schedule. But little changes have happened over the years because of the COVID. But more or less, it looks just the same. And MBBS, then phase 2 exam, then third MBBS part 1, which is the pre-final year. Then subsequently, we will have the final year exam. That is after completion of the MBBS part 2. Subsequently, after that, we will be having the internship for 1 year and your degree recognized by MCA will be issued. So this is the timeline of the whole MBBS curriculum. Moving on to the year-wise subjects, you'll see the first year MBBS, you'll be having anatomy, physiology, biochemistry. In the second year, you'll be discussing about the pathology, pharmacology, microbiology, and forensic medicine. In the third year, you'll be having community medicine, ENT, and ophthalmology. And the final MBBS part 2 or the fourth year, we'll be having medicine, surgery, orthopedics, OG, that is obstetrics and gynecology and pediatrics. And we'll also have other electives as well. Followed by that, we will have the entire rotation of internship, as already Dr. Pallavi Madam has told, how it will be rotation posting along with community medicine. Those will be involved. Since we are running short of time here, we will just overview of what all the subjects covered over here. We'll go in deep, like how it is happening in the second session. Now, a little bit in the concluding part of the session, we'll discuss like what is the ultimate transition required when it comes to a school to a medical college. I would like to call Dr. Wasim sir.
Am I audible now? I hope.
Yeah, sir.
It's fine now. Yeah, actually, the point which we were discussing before, in the state which because it will impact care as well further. Because when you're when you're aiming for something high, like you become a life, the first you're taking now. Well-being task is always is very important. So now that the state is going to take your MBBS also matters because the state we are doing MBBS is the state also
Wasim sir?
PG seats there as well. Yeah.
Dr. Wasim, I think your voice is still breaking. I think you can drop off and rejoin again.
Is it audible now?
You can drop off and rejoin again, I hope. So coming back again to the exact, the need for counseling guidances, there are so much options in your hand and so much confusion will be there at the same time. Since the ratio is 1:10 for the counseling aspect, the need of counseling guidance is also very important because that makes a difference. A well-begun task is half done always. So choosing the best college or institute in the best state will be helpful throughout their entire career, even for preparing for a post-graduation, even for super specialty, and you're practicing in the metro or non-metro cities. So we already designed a package, a premium package, the NEET Predictor team. I would like to call upon Madhavji to explain about the premium package features related to the NEET UG.
Yeah. See, actually, like we do have like premium package guidance like service as well. So, like in this premium package, we are giving like lots of like services. So, first of all, based on their rank, like we are like giving them the personal mapping. Personal mapping means based on some particular student rank, place, choice. So, like which all colleges, like in short, like best fit colleges. And apart from this, like we are giving the like we are helping them in making the strategy. For example, if some candidate like is from some particular state, so how to approach the counseling means like either they have to go through all India quota or else they have to take seat through state counseling. In which round they may get the seat. So those comes under like the strategies. And apart from this, like we are giving one-to-one personal like counseling session to clear their doubts and regarding the document which all documents they need and how to do the like registration and how to do the choice filling is one of the most important like the stage of this counseling, one of the most important. So based on choice filling only you will be getting the seat. So which order they have to put based on lots of factors they have to see. And the student they can't do that much internal research. We have did the research and all regarding the bond, like regarding the fees, regarding the seat leaving penalty, and there are few colleges which they have to avoid. And regarding the academic details, regarding the accommodation, hostel facilities and all, and regarding the college feedback, we do have all those reviews. So they can join us and we'll be guiding them, like we'll be happy to guide them.
Yeah. So here are some testimonials which will be popping up the screen from multiple students over the years. So I would like to again call upon Dr. Wasim sir, since your voice was interrupted earlier. Now we're back with a bang, I guess.
Dr. Sridhar, am I audible now?
Yeah, sir, audible, sir.
Okay. Yeah, see, the problem was it's raining out here. So probably there was an issue with signal. Yeah, it's not an issue. Yeah, am I audible now? Is it clear, Dr. Sridhar?
Yeah, sir. I think you can turn off your video so that it will be much clearer.
Yeah, if in case the audio goes a bit blur, you can tell me. I'll just switch off my video and then continue.
You can switch off the video.
Dr. Sridhar, actually, yeah, okay, fine. I'll do that. Yeah, hope I'm clear now. See, the
Yes.
importance of the guidance now is important because, like I was telling, when you are aiming for something high, a well-begun task is always half done. So if you want to become a cardiologist, so first you have to enter into MBBS, clear your MBBS, do as a post-graduation called as MD General Medicine, and then later you have to again do a 3 years of super specialty called as DM Neurology, it's DM Cardiology. Then you will become a cardiologist. Okay, so this is a process. So it's very important that the very first step which you're taking is important, and the place where you're going to do MBBS is also very, very important. So as Dr. Pallavi ma'am has also emphasized the importance of selecting a MBBS course in a state there are a lot of medical colleges, is because in a medical college, if there are undergraduate seats, that is MBBS seats, the college will also be having postgraduate seats. So it goes in parallel. So if there are undergraduate seats, there will be adequate number of postgraduate seats also in that particular state as well. So once you study MBBS in that state, you will become a local candidate of that state where you have studied MBBS, and you'll be having more opportunity of getting a postgraduate seat in that state. So at this stage, I feel this is something which you need to keep in mind. The detailed discussion we will do in the further sessions as well. Now, transition from school to college. That's what when I started the session initially, I told you. Till now, you have been in college. You are called as college-going student. Now you are going to be called as professionals, because now you are going to a college where you will be learning something a day in and day out, which will be helpful for your practical purpose. Because whatever you are learning now, you are going to implement it as well. So, as Dr. Sridhar has already told about all the subjects which you will be having in the all over your MBBS thing. Now the government of India and Medical Council has made sure that there will be early exposure of the students, even from the first year as well. That they will go to the clinic setup, they will see the patients, like not completely, but just they will see how the patients are being seen. From second year onwards, the clinical postings are starting off. So early exposure to the clinical field, application of your knowledge to the practical thing all comes into the picture when you are going into enter the medical course now. And then later, as I told you, the very first step is very important. There is high importance of getting a proper guidance where to go and how to approach. So all the guidance you can contact us. Dr. Sridhar, I think I can overtake from this. Yeah.
Thank you. Thank you, Dr. Vasim. That was very insightful. We will discuss about the MBBS curriculum and post-MBBS scope in the upcoming sessions as well. So this session stands like a base for everyone who are coming from a school to a college. If they have seen this entirely, they will get a clarity like what they want to do for the upcoming 5 years and beyond. So any doubts, you can always approach www.neetpredictor.info. Make sure you note it down, www.neetpredictor.info. Also, I would like to call Madhav to make a concluding remark for this session.
Yeah, hi. So, I guess the candidate, they like this session, and even though their parents, they like this session. So we are coming with lots of new information regarding counseling, regarding medical colleges, how to choose the colleges, best fit colleges, which all colleges they have to put, and based on their NEET score, which college will be the best suitable college. So we are coming with lots of video. So I'll request all candidates or the viewers to like this video, and please try to share this video with your friends, colleague, whoever are looking for this MBBS admission and all. And please don't forget to subscribe this channel.
Yeah, exactly. So thank you once again for the NEET Predictor team to make this session a successful one. Also, the team from Nucleus Daughters. And thank you for inviting me to moderate this session. So once again, good evening. A well-begun task is often. With a good note, we will end the session for today. We'll keep the chat box open for another 30 seconds. If any queries is there, we can drop them in the chat box. We'll try to address. Thank you once again.
Thank you for calling me for the session today. It has been a great experience. And I wish the students all the very best. Please get correct guidance and I wish you all the best for your future endeavors as well. And there are a few more sessions upcoming. Please subscribe to our channel. We will discuss all the further important as well as the counseling process unfolds. So stay connected to us and have a good evening. Thank you.